Right now, hospitals in South Carolina usually need permission from the state before adding more beds or expensive equipment. But due to the pandemic, some of those requirements were suspended. 7 News' Jason Raven tells us why there's now a push to permanently repeal these laws.
Well, South Carolina lawmakers have filed a handful of bills to repeal certificate of need laws in the state. Now, none of those bills were passed this year, so any changes would have to wait until 2022. Certificate of need regulations were put into place by the federal government back in the 1970s, and according to DHEC, their purpose is to promote cost containment and prevent unnecessary duplication of healthcare facilities and services. But some say the laws are outdated.
The federal government actually rolled that back over 30 years ago, and there are 15 states as well that have rolled theirs back. South Carolina, unfortunately, is not one of those 15 states.
When a healthcare provider in South Carolina wants to add beds, build a new facility, or purchase expensive equipment, they need to go to state health officials for approval to expand their services. Now, competitors can appeal these requests, thus slowing down the process. And in 2020, Governor McMaster waived these regulations for services related to the pandemic. Now, some say this suspension shows the regulations should be repealed.
So for them to be able to increase that capacity rapidly without having to go through this archaic system of getting a permission slip, not just from the government, but approval from their competitors, allowed for them to provide care for more patients across our state.
The South Carolina Hospital Association says they don't believe certificate of need laws should be fully repealed, but reformed. They would also like to see the appeal process sped up.
There are things that can be improved. Increasing price thresholds to purchase equipment or add a capital expenditure like an operating room.
A spokesperson for the governor says they don't have a specific timeline for when the suspension may be lifted, but their office is in communication with state agencies and other stakeholders constantly. In Columbia, Jason Raven, 7 News.
Keep this in mind, too. 34 other states have certificate of need laws in place.